Good afternoon, everyone. We'll call this meeting of Health and Human Services to order. Colleagues, today we have two agency report outs. We have the Maryland Department of Health, Development and Disabilities Administration, and we also have the Department of Human Services Office of Human Energy programs. We'll get started with the first, and we'll ask Ms. Victoria Martinez if she could come to read out the budget analysis.
Thank you, Mr. Chair and members of the committee. My name is Victoria Martinez, and I'm with the Department of Legislative Services. Today, I'll be presenting on the Developmental Disabilities Administration analysis. The Developmental Disabilities Administration, known as DDA, provides services to intellectually and developmentally disabled individuals, primarily through state facilities and community-based services. As you can see on the first page of the analysis, the fiscal 2025 allowance increases by $195.1 million, or 10.2%, for a total of $2.1 billion. Moving on to page 4, the first performance analysis discusses individuals served in DDA waivers. One of DDA's primary goals is to increase the number of eligible individuals receiving community-based services who are enrolled in a home and community-based services waiver to allow DDA to claim federal funds for these services. As shown on Exhibit 1 on page 5, there were 19,316 individuals served in community services, excluding those who are supports only in 2023. This measure was revised last year to exclude counting permanently ineligible individuals. There were 18,430 individuals served by a DDA waiver, a percentage increase from 93% in fiscal 2022 to 95% in fiscal 2023. DDA offers 3 waiver programs under Medicaid, including the Community Pathways Waiver, the Community Supports Waiver, and the Family Supports Waiver. Page 6 outlines the number of individuals in each of these waivers, with 750 unfilled slots in fiscal 2023. And DLS asked that DDA comment on why there were unfilled slots and efforts to fill available slots. The second performance measure discusses the community services waiting list placements. Exhibit 2 on page 7 shows the number of individuals on the community services waiting list, with 3,716 total individuals in fiscal 2023, which is a decrease from fiscal 2022. These are broken down into 3 categories, with the highest need being crisis resolution, which are individuals at risk of harm or homelessness without services, and the lowest need being current requests, which are individuals at no risk for harm or homelessness. DLS asked that DDA comment on the status of efforts to continue to reduce the wait list. The last performance measure looks at the waiting list equity fund balance, which was established to ensure that funding associated with individuals served in a state residential center follows them as they transition to a community-based care setting. As shown in Exhibit 3 on page 8, the balance has continued to increase throughout the years due to low spending, with a $2.8 million increase in 2023, which is the largest growth in recent years. DLS asked that DDA discuss why the fund continues to grow and any limitations and efforts to expend these funds. Moving on to the discussion of the fiscal 2024 working appropriation on page 9, there was a $198 million decrease from fiscal 2023 to 2024, primarily due to one-time expenditures in 2023 that are no longer needed in 2024. Most of these one-time expenditures are advanced payments to providers to support their transition to LTSS, in addition to also paying ongoing provider claims. MDH reported that it is in the process of recouping the advances, and so DLS recommends adding language restricting funds pending a report on the advance payments and claims paid to providers in fiscal 2023, including the amounts paid, reasons for providing advance payments, and plan to recoup duplicate payments. Fiscal 2024 also decreases due to the end of short-term flexibilities authorized by CMS through an emergency preparedness and response appendix to DDA's waiver programs referred to as Appendix K. This was used to bolster payments to providers during the COVID-19 pandemic, and DLS asked that DDA comment on additional details of these Appendix K flexibilities. Moving on to the discussion of provider rate increases on page 10, fiscal 2024 included a mandated 4% increase and an additional 8% increase to keep pace with the accelerated increase of the minimum wage in accordance with the Fair Wage Act of 2023. MDH published information on the Maryland Medicaid increased provider rates, detailing an 8% increase for all agencies except for DDA, which listed a 7.7% rate increase. And DLS asked that MDH clarify whether the provider rate increase was applied differently for DDA services. Continuing with the legislative priorities in fiscal 2024, the budget bill included a grant of $50,000 for the ARC of Howard County and of $150,000 for the Community Services for Autistic Adults and Children. Neither of these grants have been awarded as of February 15th, 2024, and DLS asked that DDA provide a status update. Exhibit 4 on page 11 shows an overview of agency spending in fiscal 2025. Most of the budget, about 97%, is for provider payments within the Community Services Program, including 59% for residential services, 11% for day services, and 10% for support services. About 9% of the budget is also allocated towards self-directed services, and the remaining 3% of the budget is utilized for program direction and other operating expenses. Exhibit 5 on page 12 shows the breakdown of the $195 million increase, with the largest changes being within the Community Services Program. This includes $68 million for community services growth, which also includes increased provider rates from the LTSS transition, $66 million for the 8% provider rate increase in fiscal 2024, and $58 million for the fiscal 2025 provider rate increase of 3%. DLS asked that DDA provide a detailed breakdown of the community services growth, including how much of this growth is attributed specifically to LTSS. Page 13 summarizes the DDA provision in the proposed Budget Reconciliation and Financing Act. The BRFA provision allows DDA to establish a limit on the maximum dollar amount provided for individual directed and family directed foods, goods, and services, known as IFDGS, to individuals participating in the Community Services Program who self-direct services. MDH previously had a funding cap for IFDGS, but the cap was removed by the Self-Direction Act of 2022. The BRFA provision allows MDH to resume a cap on IFDGS services, and MDH advises that they plan to implement an annual cap of $5,000. DDA reported that reinstating the cap will limit expenditures for self-directed services in fiscal 2025, and DLS asked that MDH discuss the expected fiscal 2025 savings from the proposed $5,000 cap. DLS also notes that the proposed budget assumes that the cap on IFDGS funding is in place in fiscal 2025. If the General Assembly rejects the BRFA, or if the federal government denies the waiver amendment request, a deficiency appropriation of an indeterminate amount may be needed next session. Moving on to personnel, there are 26 additional positions, which include 24 contractual conversions approved by BPW and 2 new positions. DDA currently has 37 vacant positions with a vacancy rate of 20%. Moving on to the issues section, the first issue on page 16 discusses DDA's ongoing transition from prospective billing through PCIS-2 to fee-for-service reimbursements paid through the Long-Term Services and Supports, or LTSS, system. Exhibit 6 on page 17 shows the timeline and number of providers and participants who have transitioned at least one service to LTSS as of April 2023. And Exhibit 7 on the next page shows this transition by provider size. As of February 8th, 2024, DDA reported that 79% of providers have fully transitioned, and an additional 19% of providers have partially transitioned to LTSS. DDA reported anticipating transitioning 100% of providers by September 1st, 2024. As a part of this transition, DDA was required to conduct a rate-setting study to set the rates for community services based on actual costs of providing services. The results of the study were released in November 2017, but were further adjusted. And DDA reported that the rates are finalized and that in the fiscal 2025 allowance, compared to the 2024 rate chart provided by the department's actuarial firm, residential services are funded at 86.3%, meaningful day services at 96.9%, and support services at 104%. DLS asked that DDA comment on why these rates are not funded at 100% and what the cost to reach 100% would be. Exhibit 8 on page 19 compares the reimbursements that providers received in the PCIS-2 system compared to in the LTSS system, with a 7% increase in residential services and a 9% increase in meaningful day services. This shows that there was an increase in their average reimbursements to providers in this transition. DLS asked that DDA discuss whether the allowance adequately captures the expected cost of all providers having fully transitioned to LTSS. In addition, DLS recommends adding language restricting funds, pending the submission of a report on the status of the transition to LTSS, including year-to-date spending data. The second key issue that I'll discuss starting on page 20 provides revised data on individuals served in the Community Services Program. As previously mentioned, one of DDA's main goals is to claim matching federal funds for an increasing number of HCBS waiver eligible individuals. There was an error in DDA's fiscal 2024 managing for results data since it improperly excluded data from LTSS. DDA submitted updated data on the enrollment and costs for people served in the Community Services Program. Exhibit 9 on page 20 compares the original and revised enrollment data, including the percentage change. This exhibit shows that although the revised data increased the percentage of individuals reported as served in all DDA waivers for fiscal 2018 and 2022, it decreased this percentage for fiscal 2019, 2020, and 2021. Exhibit 10 on page 22 shows the number of individuals served by DDA HCBS waivers by program, while Exhibit 11 on the same page shows the cost per individual for DDA waiver programs. Finally, our recommendations are listed on page 24. The first recommendation is annual language that restricts appropriations provided for the Community Services Program for that purpose only. And I previously described the second two recommendations, including the report on year-to-date spending data and LTSS. and a report on the upfront lump sum payments to providers and plans to recoup advanced payments. And that concludes my presentation, and I'm happy to take any questions.
Seeing no questions at this time, like to bring up the respective agency to comment on the budget readout. Madam Secretary.
Good afternoon, Chairman. Oh, good morning, Chairman McCray. Still morning. And members of the committee, Laura Herrera Scott, Secretary of Health for the record. Ms. Martinez, thank you as always for the detailed analysis on the DDA budget. I'm joined today by Marlena Hutchinson, who's our new Deputy Secretary of the Disabilities Administration. We are very fortunate that she said yes to us. She's been with the state for 29 years, most recently with Medicaid, overseeing their home and community-based waivers, and has deep institutional knowledge of the waivers and the relationship with CMS. So we're really excited, or I'm excited to have her sitting here next to me today. Also at the table is Mr. Robert White, who is the Disabilities Administration, or the Development of Disabilities Administration Chief Financial Officer, and Mr. Nick Gabor, or Chief Operating Officer, and Mr. Nick Gabor, Chief Financial Officer. Fiscal year 2025, DDA will continue to improve quality of care and availability of services to Marylanders with intellectual and developmental disabilities. As I shared, Ms. Hutchinson, or Deputy Secretary Hutchinson, joined us January 10th. So she really is new in the role, but she's very familiar to the Disabilities Administration, as well as the work that DDA has done. We both share a common vision for equitable, efficient, and responsive services across our state, which are data-driven, outcome-driven, and managed for results. So I'm going to turn it over to her. We have I think you have a short slide deck that we provided, as well as our written responses, but I will like to turn it over to Deputy Secretary Hutchinson.
Good morning. Thank you, Secretary Herrera Scott, and thank you, Mr. Chair, committee members, and thank you, Ms. Martinez. It was a pleasure working with you. I would like to briefly introduce the work of the Developmental Disabilities Administration and discuss highlights that we're going to be working on in the coming year. The Developmental Disabilities Administration operates 4 regional offices and 3 Medicaid waiver programs, and funds services for over 25,000 Marylanders, including approximately 20,000 home and community-based services, individuals who are receiving home and community-based services. DDA serves children and adults and funds 52 types of services and supports across the waiver programs, which range from group home services to assistive technology to employment and more. The DDA partners with over 15,000 direct support professionals and hundreds of provider agencies to offer home and community-based services across thousands of locations in Maryland. In the coming year, we are looking forward to several notable advances in DDA services and operations. First, we are in the process of completing an end-to-end mapping of DDA eligibility and services, and to become more efficiently serving to Marylanders with our services. We're also very interested in addressing program complexity. Second, we will expand our commitment to healthcare equity and access by ensuring that all people and families, especially those in underserved and underrepresented communities, have access to quality services and funding. In too many cases, we are finding that getting through the door has been a function of affluence and education. Third, we are excited about announcing our transition to LTSS Maryland, which is a fee-for-service payment platform, and moving out of our prospective pay system. We will complete our LTSS Maryland transition the second quarter of fiscal year 2025. Through the proposed fiscal year 2025 budget, we are excited to expand our commitment to Governor Moore's priority to make Maryland a state that serves by adding 2 new merit positions to DDA to improve our operations and management. We will have a specific focus on transformative program integrity activities and expand oversight. Under the proposed budget allowance, we will also provide a 3% cost of living adjustment to our provider rates. The DDA team and I are focused on building transparent and trustworthy programs. We are committed to the people, families, and partners across the state of Maryland to make sure that we provide equitable access and quality services and supports to all. I would like to now briefly turn over to our answers to the Department of Legislative Services questions. In response to the two reports recommended by DLS, the department concurs with both requests and respectfully requests that no funds be restricted pending the submission of those reports. In response to the first question regarding unfilled waiver slots in fiscal year 2023 and efforts to fill waiver slots in fiscal year 2024, a certain number of unfilled slots are expected due to enrollment and attrition, and in order to accommodate for reserve capacity categories which serve individuals in crisis situations and other purposes. Additionally, two of DDA's waiver programs are fairly new. They are the Community Supports and Family Supports waivers programs. And since they are relatively new, they have attracted fewer enrollments. The DDA has taken steps to increase enrollment, including amending these waivers to support more transitioning youth, as well as removing participant budget caps. For the second question regarding the status of efforts to reduce the wait list, DDA follows its federally approved waivers to identify individuals on the wait list with the highest need, as well as individuals who meet specific reserve categories. Additionally, all DDA waivers contain in the Wait Act reserve slots, which supports individuals currently on the wait list to access services. We are additionally leveraging our existing partnership with the DD Council and other stakeholders to create plans to reduce the wait list. For the third question regarding the Waiting List Equity Fund, the fund continues to grow due to statutory restrictions on spending contained within its authorized statute. The DDA continues to seek options for spending within the fund through our partnerships, again, with the DD Council and other stakeholders, particularly if the statute were to be amended. For the fourth question regarding the Appendix K flexibilities and those that have ended and those that will remain permanently in the waiver applications, we have provided you our written responses in that regard. For the fifth question regarding the 8% provider rate increase of January 1st, 2024, rates were increased by 8% on this date as applied to the fiscal year 2023 rates. Previously, a 4% increase was also applied to the fiscal year 2023 rates. Therefore, the net effect of the 8% increase was actually 7.7% because both rate increases were applied to the same base year of fiscal year 2023. For the sixth question regarding the status of grants to the ARC of Howard County and Community Services for Autistic Children and Adults, DDA has reached out to the grantees to initiate the grant application process. For the seventh question regarding community services program growth, $58.2 million in growth is attributable to the 3% provider rate increase, while the remaining $134 million in growth is attributable to an annualization in growth in community services. Available waiver slots are also planned to increase by 3.3%. For the eighth question regarding a cap on individual and family directed goods and services for individuals who self-direct their services, DDA anticipates that if 1,000 participants use 100% of their budgets, the fiscal impact would be approximately $90 million. At this time, there are 3,000 participants self-directing their services. So if all 3,000 use 100% of their budgets, DDA anticipates about a $270 million cost. These are currently unbudgeted expenditures that the DDA participants in the traditional service model do not utilize. The potential to use 100% of the personal budget is only present in the self-directed model due to the provision of the law. For the ninth question regarding quarterly reports on the LTSS transition, the second quarterly report was submitted to the General Assembly on February 20th, and the third quarterly report was submitted to the General Assembly, will be submitted to the General Assembly in early March. For the 10th question regarding funding of rates in fiscal year 2025, the DDA will continue to evaluate our funding percentages as more providers transition from our prospective pay system into LTSS Maryland, and as providers submit their general ledger data. For the final question regarding adequacy of the fiscal year 2025 funding allowance, current projected expenditures under 100% fee-for-service billing in LTSS Maryland are projected to fall within the total fiscal year 2025 allowance for community services. The Maryland Department of Health and the Department of Budget and Management will continue to closely monitor DDA's budget and will update the General Assembly on the transition of LTSS Maryland. This concludes our prepared testimony, and we are now prepared to take questions. Thank you.
Senator Hedelman.
I admit I'm totally new to this, but I just have a question and you alluded to it, so I figure it's my duty to follow up. And that is with regard to your comments about the waiting list equity fund balance. And you alluded, well, you were pretty direct about statutory restrictions and that if there were amendments to change that could be spent. And I wonder if you could expand upon that and whether there are any legislative initiatives to do what you are referring to.
So it would just allow us to move money within the program. And so right now that fund is just for that purpose. And so if we don't have a need for it in that year, it's just rolling over and accumulating, but having that authority would allow us to move the money within the DDA administration.
And can you talk a little bit about what does this statute require? How is it directed right now that is making it so restrictive and that the need isn't there for the funds to be spent?
Can we get back to you on what the statute language is as far as, how it's walled for that particular program?
Sure. But even if you could shed a little light on the program and the services it provides and why they are not needed.
Yes, thank you for the question. So basically the fund is used for participants who are in state residential centers to help pay for their services as they integrate into the community for the first year of their services.
Okay, if we could offline go more into detail, I would appreciate it. Thank you.
Senator Zucker.
So with the, first of all, good morning.
Good morning.
Sorry. Total in business mode. I apologize. Thank you for everything you all are doing. So in terms of following up on Senator Hedelman's question, so would it require, is this something we could do through the budget or would this require legislation to make any kind of statutory change?
So I think it requires statutory. I think the way the language was written for this particular pot of money is statutory change. But we can get you more details, including why it's not, why it's underutilized. Because the dollars are for the first year. And so the number of people using the service, it just may be overfunded. But let me get back to you and at least we can go back a couple of years and give you a reason why the fund is where it is, but it would require statute change.
Thank you. And then
we can provide that language.
Okay. And then in terms of the two legislative priority grants, when will they get it?
Want to speak to the grants?
Yeah. I know they're in the process. I definitely heard what you said, but when do you think it'll actually get to them?
So we just reached out to the grantees and we're hoping to have that process work within the next few months.
Okay. And then with the end the wait, the chair Gazzoni and I put money in the dedicated purpose account. And it was and then we updated it through legislation that would allow not only for us to get, this amazing population from the wait list into care, but also providing more opportunities to hire and retain providers. And I was trying to get a sense of sort of where that is. And my understanding was that some of the money was not going to providers. I just wanted to kind of get a sense from you all what was happening with it.
So I don't know that the money is going anywhere but the providers, but as far as the $10 million that was earmarked, we're working with the DD Coalition on how best to address the workforce shortage issues that exist. I mean, we have 15,000 direct service providers, and the 3% bump is, I'm sure appreciated, but it's not enough. And especially, some of the convenience stores pay more. And so when people are, trying to maintain their families, there's just more work for us to do. And so we're going to be using those dollars in partnership with the DD Coalition to figure out what the best way forward is on not only bringing on new workforce, but then retaining the workforce that's currently in place.
Thank you, Madam Secretary. Try my best also, that folks come and give public testimony after you do, so I wanted to get to some of the written testimony questions. Can you speak to the rate review advisory group, the meaningful day services, and where we're at this part from that standpoint?
So the rate review advisory group is the group that comes together. There's a charter for the group that comes together to determine the rates moving forward. Last year we had 6 meetings. This year I think we cut it down to 4 or 5 meetings. And the reason why the pace of the meetings and the need for the data analysis wasn't giving us enough time to prepare for the meetings. So that we just had a meeting in January to redefine the priorities, because there were 7 or 8 things on the list that we can't do just because of the analysis required. So we did identify the top 3 priorities. The rated review advisory group identified the top 3 priorities. And so I can't remember, was that one of the 3 that they picked for this year?
No, they productivity, acuity,
Employment.
And
employment services.
So that's what's on the agenda for this year, based on the voting of the members of the advisory group. So Meaningful Day, I'll have to get back to you. Do you want to comment on Meaningful Day, since it wasn't on one of the things that were selected this year?
Yes. So prior to continuing the transition or expanding our pilot into LTSS, we've asked providers to fill out a fiscal impact analysis tool. And based on the tool and some of the inputs from the providers, it was showing that if they moved into the fee-for-service payment methodology, that they wouldn't be as good off as they were in the prospective payment system. And through meeting with some of the providers, we totally got an understanding of why they would think that. However, but since then, we have moved Meaningful Day providers into the system. We've received feedback from them that they've seen their best year from a revenue perspective in many years. And we've been actually teaming them up with the other Meaningful Day providers to provide them technical assistance and other things and things like that. And so we're confident that the rates for Meaningful Day services and the fee-for-service environment are more than adequate, just based on the feedback we're getting from those providers who are currently billing for those services.
Okay. I'll move to the second question, which there was a couple pieces of written testimony about the Medicaid redetermination and the transparency around the respective issue. Would you be able to comment on that?
Sure. So if I can just take a step back, we had 1.4 million Marylanders prior to the public health emergency. And then during the public health emergency, redeterminations were stopped. So people that were currently in the program didn't have to do redeterminations. And then we had new people enrolling into Medicaid. And so we went from 1.4 million Marylanders in Medicaid in 2019 to 1.8+ million Marylanders in Medicaid as of last year. And then the federal government came out with guidance that the public health emergency was over and we had to start turning on redeterminations. States had the choice of 6 months or 12 months. We took the 12-month option first. We went with what's called the Magi group first, which are those people that we can use like SNAP eligibility, IRS documentation to renew them automatically. Those are referred to as the ex parte renewals. And of those 1.8 million Marylanders that have gone through redetermination, 1.6 plus are still in Medicaid, but the disenrollment of Medicaid individuals is about 20,000 per month. We post all our results monthly now on our MDH website. We've been working with CMS, and not only do we break it down by race and ethnicity, but we're also reporting by zip code, because we saw churn happening in zip codes, in more underprivileged zip codes. So we were blitzing and doing more marketing and outreach in those zip codes. Now, as it relates specifically to the DDA population, many of the individuals that are enrolled in the waiver, they don't go through the same redetermination process by virtue of the fact that they're also receiving SSI benefits. So of the 18,000 plus Medicaid participants that are enrolled in a DDA waiver, only 4,200 of those individuals actually have to go through the redetermination process. Of those, 88% have extended their coverage. So 2,917 of the 4,200 have their coverage. Approximately 400 have lost their coverage, but half of that 400 have regained that coverage. They were procedural disenrollments. We worked with those individuals and they were covered. So as of right now, 75 participants had lost their coverage for procedural reasons. When we went back and looked at the data, there was a problem with the timing of our letters. So they start at 75 days and then, they go as you get closer to the time that you have to re-enroll. And there was a timing of our letters going out for when you have to apply to, okay, you've lost your coverage. So 25 people were automatically re-enrolled, and their timeline for going through the procedural redeterminations was extended. 118 participants did lose coverage because they were found to be ineligible for Medicaid. So of the 18,000, 4,200 had to go through the process. Right now, 118 were found to be ineligible for Medicaid. 50 were disenrolled for procedural reasons, and we're working on that. Now, we still have March and April to go through. So we started the redetermination process in May of last year, and our fiscal year ends of April this year. So in full disclosure, there may be more disenrollments based on the timing, but we are trying to understand or work with those families, especially for the procedurals, because they haven't had to do this for several years. And in some cases, they've never done this. In some cases, we have the wrong address because people moved during the pandemic and the notices are not getting to where they need to. So we're working with the 50 so far that have been removed for procedural reasons, but 118 were disenrolled because they were deemed to be ineligible for Medicaid coverage. And that's a lot of puts and takes, but I'm happy to clarify where we are again.
Thank you, Madam Secretary. And you're one of my favorites, but the report that came in on February 20th, I haven't seen it as of yet. So I'll ask if the agency can send over a report for the LTSS transition.
Oh, for the LTSS transition?
Yes, ma'am.
So that I have no excuse. That is just late.
Yep. And you all responded with the third report will be coming early March.
Mm-hmm.
Because that's late also. Would it be coming the first week of March?
So the second report was late. The third report is being worked on. So it's just then the third report, it has to go through the system. So I hope the third report is not late, but the second report is unfortunately just late because it's late.
Okay.
I don't have an excuse.
Yes, ma'am. And I only say that question because we talked about the issue last year. Feel very confident that you all have done a job transitioning providers into the system, but we also have to understand what are some of the challenges that the providers may be having as they do transition into that system. It's a piece of written testimony here that speaks to the uploading of the billing data for that piece of it. And when we get the reports, hoping that the reports speak to some of this or how are we working through some of those pieces. So if you would want to comment on the LTSS transition, but more importantly, this umbrella organization, I guess, that represents providers, what would they do if they are having challenges from a billing uploading standpoint?
Do you want to take that question or Robert?
Yes, if providers are having issues with uploading data or any billing issues for that matter, they can reach out to me and I'll make sure I put them in touch with the correct individual that can help them address.
I appreciate that. And the last question, this one's a little bit tougher. Not tougher for me to ask, but like just hard to frame. So I'll read you verbatim. However, that has been a challenge on the compensation that providers are able to pay. The staff to which I am referring are direct support professionals. So they are talking about, I guess, the pay scale in reference to the direct support professionals. If you just wanted to comment on that piece of it, because I didn't fully understand.
So that's what I was commenting before. So there are 15,000 direct support professionals and they are getting the 3% bump, but the base from which they were starting from is still not good enough. And so that's some work out of the $10 million that we received to address the workforce challenges that we're going to be working with the DD Coalition. I will also say, and I testified to this, or I might have mentioned it at the DD Day at the graduate. Those are also many of those providers are from Black and Brown communities. And as I said, even with the 3% bump, you know, places like Royal Farms and other places like that pay more money. So it's not only, you know, we don't disagree with the adequacy of the payment, but it's also difficult to retain and recruit based on that. So that's something we will be working on with the DD Coalition to understand what is the right amount and what's needed based on the requirements of the role.
Yes, ma'am. That's no further questions from me, but Senator Zucker, Senator Hedelman, second bite at the apple. Yes, ma'am.
Thank you very much, Mr. Chairman. I have to go back because I recalled that someone had reached out to me who has what she believes to be very, very beneficial for her child who they're in the self-directed program and they're very concerned about the provision that's in the BRFA, and has said that for the first time this summer, they were able to get some services and have the flexibility similar, you know, have the budget authority and have the employer authority to be able to tailor services that were best for her daughter in this case, and that they weren't asking for anything that was any more than people who are in traditional, you know, who get traditional services through a group home or others are getting. And so was very, very concerned that for the first time it had the flexibility to be able to address those needs of her daughter, that if that were rolled back, that would be a huge challenge for them. And so I wonder if you could speak to that. I know you mentioned in the testimony that, you know, kind of the full budget impact of everyone where you use the full budget authority, but from her perspective, there's a cap on what she is able to use, and that just having that flexibility within that cap to be able to direct those services is incredibly beneficial.
So the flexibility doesn't go away with the BRFA language. So they have the flexibility to redirect the budget, how they want to redirect the budget. I will say with the removal of the cap, we've seen increased expenses. And at the time that the statute was passed, which was certainly prior to my leading the agency, I don't know that there was a fiscal note that was attached to it. So what we're seeing is increasing expenses. And as Deputy Secretary Hutchinson testified to, upwards of $270 million to $90 million to $270 million. So the flexibility is not gone, but the authorities under self-directed are different than traditional in their ability to keep any savings and roll it over. And that doesn't exist on the traditional side. So, yeah.
Just one follow-up, and there's something in here about seeking a federal a waiver and approval from CMS. Is that not something that should have happened earlier?
Again,
I mean, prior to you.
Yes. So normally when programs are made to the changes are made to the program, we have to make sure that we have the authority to make those changes. And I can't speak for what happened during the prior administration unless you want to take it. But the authority to do some of the things that the administration was doing has not been approved by CMS. And so we are in discussions with CMS, and the way we make any changes to any of our waivers, it has to go out for public comment. So everyone would see what's being proposed, but we're having those discussions now with CMS to understand from them what they need from us.
Okay, just for my clarification, is that something that should have been done years ago a few years ago when this was first instituted? Or is this something that they're raising now? Or we're just double checking? Help me understand the process here.
When you say, is it something that they should have done before, are you talking about the BRFA language?
No, this or CMS.
So there definitely should have been a conversation with CMS in advance of that act being passed. So as Secretary Scott said, the department would have to petition to CMS to get those changes in the waiver application. And within that process, there is a public comment period and so forth. The act happened in advance of the change to the waiver application.
Okay, thank you very much.
Senator Zucker.
Thank you very much. When I'd love to kind of connect with you all offline, maybe pull in some folks, because I'm getting advice from council that when it comes to the waiting list equity fund, that you already have a lot of flexibility to help with using that fund for people leaving institutions and people on the waiting list. So maybe we don't have to have this discussion now, but maybe we can huddle afterward and just figure it out. Thank you.
Madam Secretary, seeing no more questions at this time, we're going to move to the public testimony component. Yes, ma'am. For the public, we do 2 minutes in reference to public testimony. We're going to call folks up 2 at a time to come to the respective microphone. And we're going to start with Tim Weens from the Maryland Inclusive Housing and Miss Kathleen Collins from the ARC of Howard County.
Good afternoon. My name is Katie Collins-Zerke. I'm the Executive Director at the ARC of Howard County. Thank you, Chair and members of the committee today. We felt it necessary to submit verbal testimony regarding the budget for the Developmental Disabilities Administration, speaking to the eligibility issues that we have been seeing. We began facing issues with our Medicaid redeterminations of those we support. And while some view Medicaid as primarily health insurance, within the realm of IDD, it's really a lifeline. We discovered that people had lost their Medicaid coverage to varying degrees. Most of the time we did not receive notice, but rather when we went to bill or when someone went to the doctor's office, we were notified at that point that they no longer had Medicaid. This loss translates to the inability to attend a simple doctor's visit, which is especially impactful for the people we support, many of whom have chronic health conditions. Fortunately, for organizations like the ARC of Howard County, we have stepped up to support thousands of Marylanders with IDD experiencing lapses in Medicaid. Consider the potential repercussions if Medicaid providers of home and community-based services decided to withhold their services until billing certainty. Presently, we are unable to bill for approximately $100,000 worth of services delivered with no resolution in sight. Nonetheless, our mission and commitment to humanity drive us to assist those in our services in living their best lives. Under normal circumstances, this situation would be challenging, but the compounding factors of historic inflation, a nationwide staff shortage, and ever-changing regulatory requirements render these circumstances unsustainable. We urge you to provide a favorable report ensuring the backbone of our service system for people with IDD, the providers of services, receives the necessary support to continue our vital work. Thank you for your attention to this matter and commitment to the well-being of people with intellectual and developmental disabilities.
Good afternoon, Chairman McCray, members of the committee. My name is Tim Weens. I'm the Executive Director of Maryland Inclusive Housing, MIH. We were funded, are funded by DDA to work with DDA on the transformation in residential services, moving from a group home model to more of a supported living model. And so this doesn't necessarily mean group homes will be closed, but as the system grows, more and more people will be living in their own homes. So if they don't live in a group home or with their families, where do they live and how do they afford that? And that essentially is the problem or the task that we were funded to take on. We do this in three ways. We provide housing support services, sort of a housing case management to help individuals and families find housing and navigate that system. We're providing those and those are waiver services that we can bill for. We're providing services to about 120 people on a weekly, monthly basis. But we've also trained other people from other DDA approved agencies to do that. We've trained over 70 people from over 30 agencies that are providing this to over 600 people on a regular basis. So that's one of the things we do. We have an information clearinghouse on our website so that anybody can see the information and kind of navigate these services. And then we have housing committees around the state that work on affordable housing issues. And our director of housing may be able to testify later in more detail about some of that. We're delighted to see in the budget $1 million for housing. We understand that there's a new DDA rent subsidy program that was started in the current year. And we anticipate this funding about 100 new vouchers in FY25. So thank you for your testimony. We're delighted to see these things in the budget.
And thank you both. At this time, if we can call up Ms. Karen Adams-Gilchrist and Ms. Laura Howe.
Good afternoon, Chair McCray, and members of the committee. I'm Karen Adams-Gilchrist. I'm the president and CEO of Providence of Maryland, a DDA licensed agency that provides support to 300 plus people with intellectual and developmental disabilities in Anne Arundel and Charles County for over 60 years. I am testifying today in support of Governor Moore's FY25 budget, specifically asking that the 3% rate increase for community services be maintained in the budget. This rate increase is extremely important to the provider community for several reasons. One of the first is it helps to ensure that the rates for services are important to every person we support are sufficient for each person to live their best lives. As a member of the Rate Review Advisory Group, I know firsthand the goal of this rate setting process is to ensure that rates are adequate for the support and services people need. As you have heard, and as you likely are aware, there's much work to be done on rates for Meeting for Day and employment being a part of Meeting for Day. For my organization, I held off going into the LTSS system because the Meeting for Day rates were so inadequate. And I only just went in November once I acquired a residential agency through a merger. My organization will see a 16% decrease in revenue as a result of the rates in the current rates for Meeting for Day, including employment services. This is not a solution for most Meeting for Day providers to acquire another organization to help with their rates. We cannot have a system that bills adequate rates for one service while the rates for another service is inadequate. Another equally important reason the rate increase is so vital is it impacts our ability to maintain a strong direct support professional workforce. Our DSPs are the background and foundation of our organization. Providence, like many other providers, continue to experience significant staff shortages. We employ 230 people, of which 74% are DSPs. Our current turnover rate is 34.4% with 39 vacant DSP positions. We continue to struggle to fill those positions, and given that turnover, people's lives are negatively impacted. So the 3% increase is vitally important, and we ask that you keep this funding in the budget. Thank you for your support.
Yes, ma'am.
Good afternoon, Mr. Chairman and members of the committee. I'm Laura Howell, the CEO of the Maryland Association of Community Services. We're here today, obviously, to ask your support of the DDA budget. I do want to say we very much look forward to working with the new Deputy Secretary Hutchinson and her team as we all collectively move forward. I have two things to highlight. The first one is it's the 10-year anniversary of the passage of the bill that you all passed mandating rate setting for developmental disability services. And that is the bill that gave us hope that we would finally see adequate rates. And there was a goal of achieving full funding by FY26. And it looked like we were on that path. And then we hit kind of a little bit of a grim budget outlook. But we ask that you consider working with the administration to the extent possible to try and keep us moving forward in achieving full funding of those rates. The other issue to mention is one you've heard about, which is people losing their Medicaid waiver eligibility. According to a survey we did of our members last week, 60 providers reported close to 500 people having lost their Medicaid waiver eligibility, including 90 who self-direct their services. So we're working with the department. Obviously, the numbers are different, and we'd really like to understand why they're different. Right now, as you heard, community providers are doing the right thing and continuing to support people, even though they remain unpaid. I did want to mention that, for example, you heard the issue of addresses needing to be updated as an issue. What we are told, particularly by case managers who are the ones who help make all of this happen, for people receiving DDA services, something happens when a new address is entered into LTSS, somewhere between LTSS and MMIS. Some number of the addresses are reverting to old addresses, and it's an issue that's been identified, but there hasn't been a solution. So it looks like there are a number of systems issues that are leading to this eligibility issue, and we really hope that we can work with the department to figure it out and create a safety net in the meantime for them. Thank you.
Thank you. Just a very quick comment. Obviously, the General Assembly has an interest in the LTSS transition too. So I hope that whenever there are issues that do take place, that you can also make sure to put it on our radar. We're going to read the report that was submitted. We'll read the next report, but just the help from the public would also be helpful.
Yes,
Thank
thank you.
If we can bring up Carol Kulster and Sharmita McCready.
Hi, I'm Carol Custer. I'm here representing the Self-Directed Advocacy Network. And we do support the DDA budget and the 3% increase, but it appears that it is not taking into account, again, fully funding people who are in self-directed services, even though it is a service model that is required by the waiver and the new law that passed in 2022 to have equivalent funding. It has always been in the waiver that the rates for self-direction would be based on the rates for traditional providers, but we have not had access to that. In the law, required that access, and the waiver was changed effective July 1st, 2023. So for the first time, like your constituents said, they've had access to funding that has always been there. It's easy to have underutilization if you don't have access. The people in self-direction have not been given access to the rate increase that went into effect January 1. That has never happened before. It's happening now. It's very complicated, but I gave you the definition of IFDGS. It is very set of services. That is only for self-direction. What we're asking for is the administrative funds that we need to run self-direction. We were not have, and that was part of the Self-Direction Act as well. They are put in IFDGS. You cannot pay an administrative support person, which is not a direct service, but coming out of the rate for that service with a $5,000 cap. So it is essential that the Self-Direction Act of 2022 remains the way it was written and unanimously passed by both the House and the Senate in 2022. Thank you.
Good afternoon. My name is Sharmetta or Shar McCready. I'm the Director of Housing at Maryland Inclusive Housing. Thank you, Chair and Subcommittee, for hearing us again today. My supervisor has already spoken, Tim Weems, and I just want to talk about specifically some of the services that we provide in Baltimore, Maryland Inclusive Housing. One of my main roles is to provide the Housing Committee, which is a cross-disability housing committee, but also, of course, a focus of IDD. And we provide currently five housing committees across the state of Maryland. Those are located in Howard County, Baltimore City, the Eastern Shore, Prince George's, and Montgomery County, with intention to actually expand across the state. Through this work, in my role as the Director of Housing, one of the key projects that we were involved with was the work in Baltimore City with the Inclusionary Housing Coalition, or the IHC. There, myself, as well as the Director of Communications, were very actively involved with the passage of the new inclusionary housing law in Baltimore City. And why does that matter? That's an affordable housing opportunity that's open to marginalized communities that also include individuals with developmental disabilities. And so 10% of new units will be set aside for people at 50 to 60% AMI, which means that they'll have access, if they have vouchers, via the DDA rental subsidy or other subsidies, to access housing in Baltimore City. Again, we do this macro level type work across the state of Maryland, representing those that are unheard. And again, we favorably support the bill. And again, thank you very much.
And thank you both. If we can call up Miss Andy Culp from the ARC of Maryland, and Randy Ames from the Disability Rights of Maryland.
I don't know what time it is. Good morning or afternoon, Chair McCray and members of the committee. For the record, my name is Andy Culp, and I'm here on behalf of the ARC Maryland in support of the DDA budget for FY25, which contains the 3% increase in rates for providers that we believe will help us hold ground. And the budget also contains funding for critical expansion services like transitioning youth and emergencies for people. You've previously heard about the issues we're facing with hundreds of people losing their Medicaid waiver eligibility following this unprecedented Appendix K unwinding effort. When a person with intellectual and developmental disabilities falls out of a waiver, it's a really big deal. Due to the nature of their disability, they cannot safely live without institutional level care. Providers are deeply committed to people with disabilities. They've served and supported many for their entire adult lives. They're not getting paid for continuing to support some of those people right now. Providers cannot drop people who have lost their waivers off at homeless shelters or hospitals without risking harm to the individuals and stresses to the other communities, other service systems. People who self-direct may be even greater risk of life disruption if they fall off the waiver, not having a provider for backup support. Providers in CCF have the skills to support a person to regain their waiver eligibility, and they should be supported to do so as the individuals allowed continuity of care during that process with state-only funding when necessary, or possibly through accessing another funding source like waiting list equity. This isn't a long-term solution, but a necessary remedy at this time. And just for information, in our approved DDA committee pathways waiver on page 48 and 52 of Appendix B, the use of state-only funding for services is allowed, known as state-funded conversions and optional state supplements, respectively. And the practice has been exercised in the past. So in closing, we implore the DDA and Medicaid, with support from General Assembly, to authorize either the waiting list equity fund or state-only funding to be used as we weather this storm for care continuity and to assist people to regain their waiver eligibility. Thank you.
Thank you, Mr. Chair and committee members. I appreciate the opportunity to speak with you today about the DDA budget. My name is Randy Ames. I'm a managing attorney with Disability Rights Maryland. We're the state protection and advocacy agency for people with disabilities. We're seeing on a weekly basis people reaching out to us in crisis, trying to figure out and navigate a very complicated system. I appreciate the fact that Secretary Herrera and Deputy Secretary Marlena Hutchinson inherited a system that is very complex and needs improvements. However, people are in crisis, and while this budget, DRM is in favor of this budget, and we appreciate the investments and the commitment that folks are making to people with disabilities. However, since April of last year, we're seeing people now facing disenrollment and lack of access to services, over hospitalizations and risk of institutionalization. And so we ask that the committee evaluate the flexibilities that are provided within the budget in order to take a pause. To highlight this issue, we have heard our clients getting different direction, but to highlight part of this complex system is an appeal. When you receive a termination notice, or if you receive one, an appeal must be submitted within 10 days for somebody to receive benefits pending that appeal. That means that person needs to know what is in the notice, actually receive it, and timely file that appeal. That is a requirement that we have under our regulation. That is not something that we have asked CMS to require of the state. We need flexibility to provide folks time to submit timely appeals or address these issues. And so again, we just ask that as many flexibilities are provided to the folks who are receiving services or have had their benefits terminated during this redetermination process in order to ensure that safety net to resolve some of these clerical errors that have been going on. So thank you so much.
Thank you both. And our last piece of testimony will come from James Orman with the People on the Go, Maryland.
Mr. Chairman, I had to sign up through James's account because I was here, so Matt Rice, but
Matt, please step up.
hello, Chairman McCray, members of the committee. My name is Matt Rice. I represent People on the Go Maryland, which is Maryland's statewide self-advocacy organization for people with disabilities. We are here in strong support of the DDA budget, which contains that 3% provider rate increase, which is essential for those getting home and community-based supports. People have alluded to issues with eligibility. I just want to make it clear that we support any measure that the General Assembly might take to address this issue, because Medicaid is the lifeline for people to get their services, and you'll see more of that in my written testimony. I want to address the issue of IFDGS. First of all, no one that is in self-direction that is using this category of service utilizes 100% of their budget to do that, and the expenditures must be approved items. We want to make sure that all people, regardless of the service model they happen to be in, have equal access to the rates and to the services that they need. I had a member who self-directs reach out to me last night who said they haven't had their staff rate increases approved that they put in for in April. So, you know, to me, that's not acceptable. We need to make sure that providers of service and people who self-direct are not unintentionally put against one another. Please make sure you fully support the DDA budget, and please make sure that we have equal access to all current and future Marylanders who need services regardless of service model, and leave no one behind. Thank you so much.
And thank you. Colleagues, seeing as though there are no questions at the moment, we're going to move on to the second agency hearing, which would be Department And first, I just wanted to lean in and say, Ms. Martinez, just thank you for everything that you do in reference to help us move forward with Developmental Disabilities Administration. Madam Secretary, just wanted to thank you for your leadership, but more importantly, wanted to welcome, congratulate, and thank Madam Deputy Secretary and look forward to continued partnership. That's the entire committee here from that standpoint. So thank you. And to all the advocates that testified, we heard you very loud and clear. We understand the issues and look forward to continued partnership with you. So colleagues, we would move on to the Department of Human Services, Office of Human Energy Programs, and we'll ask Mr. Samuel Quist to come up and give the budget analysis.
Thank you, Senator McCray, members of the committee. Sam Quist from DLS. The budget for the DHS Office of Home Energy Programs decreases by 14.5 million or 6.7% to $200.9 million. I'd like to begin. I'm going to turn ahead to page 9 of the analysis for the overview of agency spending. You can see about 91% of the budget funds energy assistance benefits. First, under the Maryland Energy Assistance Program, funding for benefits total $58.6 million. This program is federally funded through the Federal Low-Income Home Energy Assistance Program and includes funding for bill payment assistance for home heating bills, natural gas arrearage assistance, as well as funding weatherization services through the Department of Housing and Community Development. The USP program is specially funded through both the USP ratepayer surcharge and utility bills, which totals $30.6 million, and special amount of the federal funds allocated to the state of Maryland. There were some supplemental funding available in prior years. So in comparison, the allocation for fiscal 2025 is lower. There's a $5 million decrease in special funds from CEF allocated for energy assistance. There's an additional $3.6 million decrease in federal funds from the Low-Income Household Water Assistance Program. The funding for this program was available through federal stimulus legislation through the pandemic. There's a total of approximately $14 million available to the state between fiscal 2022 and 2024. However, Congress has not appropriated any additional funding through this program, so there is no additional funding for federal funding available in fiscal 2025. The other main change in the budget is $4.4 million of increases for administrative contracts with local administering agencies for the cost of administering the energy assistance programs. This increase comes from a combination of both federal funding as well as special funding from the USP ratepayer surcharge. On page 12 of the analysis, DLS notes that there is the amount of funding budgeted from the USP ratepayer surcharge fund exceeds the amount that is annually the annual amount specified in statute. There is a provision in statute which allows the carryover of some unused funds from the prior fiscal year. However, the analysis asked DHS to comment on the sources for the specific amount of those funding included in the budget. Pages 13 through 17 of the analysis include additional discussion on the use of special funds from the Strategic Energy Investment Fund for energy assistance. Under state statute, about 50% of the revenues that the state of Maryland receives from its participation in the Regional Greenhouse Gas Initiative program go towards funding energy assistance benefits through DHS. These revenues have been generally elevated in recent fiscal years. Exhibit 6 on page 14 is showing a summary of the data from some of the quarterly auctions under the Regional Greenhouse Gas Initiative program for carbon dioxide emission allowances. In fiscal 2023, the state of Maryland received about $140 million in revenues from this program. This heightened amount of revenues is reflected in Exhibit 7 on page 16, which is showing a year-over-year comparison in the amount of CEF revenues budgeted under DHS for energy assistance. In fiscal 2024, the highest amount in a fiscal year was $99.1 million. In fiscal 2025, there was approximately $5 million decrease to about $94.1 million. The remainder of this section of the analysis touches on the component of the governor's budget proposal to transfer $90 million of projected CEF fund balance to the dedicated purpose account to support provisions of the Climate Solutions Now Act and the state's climate pollution reduction plan. How this impacts DHS is that the Maryland Energy Administration in its testimony indicated that about $8 million of the $90 million would be sourced from the DHS Energy Assistance Subaccount, which would thereby reduce that amount of funding to be used for budgeting for energy assistance in future fiscal years. You can see in Exhibit 8 on page 17, the projected C fund balance accounting for the transfer is identified. The top line for the DHS Energy Assistance Subaccount, you can see there's a $13.8 million fund balance at the end of FY25 projected prior to the transfer, which is reduced down to $5.8 million, reflecting the transfer. At the bottom of page 17 of the analysis, DLS notes that there is a provision in the Budget Reconciliation and Financing Act authorizing the $90 million transfer. DLS has made a recommendation to revise the BRFA recommendation to prohibit the funding to be sourced from the Energy Assistance Subaccount and to suggest that the funds would be sourced more from other areas of CEF instead. Turning to the issues section of the analysis, which begins on page 19, the first section discusses more about energy assistance benefits. Exhibit 9 shows the year-over-year history of applications as well as recipients of benefits. You can see the number of applications has fluctuated in the past couple of fiscal years. However, in fiscal 2023, there's about a 24% increase in the total number of applications received by DHS, reflective of high demand for energy assistance. A part of this can be attributed to some of the increased energy costs that we've seen in the past year. The number of recipients for energy assistance in fiscal 2023 has increased. For the two bill payment assistance programs, USP recipients increased by about 20%, and the Maryland Energy Assistance Program recipients increased by about 24%. This is notable because fiscal 2023 increases are the first fiscal year that the number of recipients of benefits has grown. Prior to fiscal 2023, the number of recipients had declined each year from fiscal 2014. Exhibit 10 on pages 20 and 21 shows some additional data on benefits through the first half of fiscal 2024, compared year over year to the first half of fiscal 2023. You can see at the bottom of page 20 that the number of applications and the number of recipients for all four programs has continued to increase in fiscal 2024 year to date. It is estimated that through the remainder of fiscal 2024, the number of recipients will continue to grow due to changes in eligibility related to the implementation of categorical eligibility for energy assistance. This is discussed more on pages 22 and 23 of the analysis. Chapter 207 of 2023, which went into effect on January 1st, amends the income eligibility criteria for the USP program and requires DHS to automatically enroll in energy assistance benefits households that have been prior found to be eligible for other DHS benefit programs. Prior to January 1st, DHS also took action to amend the federal LIHEAP state plan in order to make consistency across the federally funded benefits, reflecting the implementation of categorical eligibility. The 2023 Joint Chairman's Report requested a report from DHS on the implementation of categorical eligibility. In its report, DHS provided a figure that it estimated around 79,000 additional households could become newly eligible as a result of these changes. In its report, DHS also indicated that it had begun to take steps to align benefit sizes in fiscal 2024 in order to accommodate the additional number of households anticipated to receive benefits within available funding levels. Exhibit 11 on page 24 of the analysis shows data on average benefit sizes for the two bill payment programs. You can see that in fiscal 2022 and 2023, the average benefit sizes had increased noticeably. The estimated percent of bill paid for the lowest income level increased in those years to about 95%. In comparison, in prior fiscal years, it had been around 80%. In fiscal 2024, the percent of bill paid declines back to about 80%, consistent with prior fiscal years. Page 26, Exhibit 12 presents data on denial rates for the 4 energy assistance programs. You can see that the highest denial rates are for the 2 arrearage assistance programs. The gas arrearage program had a denial rate of about 47%. The USP arrearage program had a denial rate of about 43%. The 2 bill payment assistance had a denial rate of about 20%. For the 2 bill payment assistance, the denial rate through November 1st has declined by about 13%. As shown on the chart, this is notable. The current 20% denial rate is the lowest that it's been in recent fiscal years. As shown in Exhibit 13 on page 27, the most common reason for an application denial is due to incomplete information. Previously, changes made by chapters 638 and 639 of 2021 allowed for a 3-month period after denial for incomplete information for an applicant to provide additional information to subsequently cure the denied application. DHS indicates that in fiscal 2023, about 16,700 applications that were denied under these circumstances were subsequently cured during this period for providing additional information by the applicant. Exhibits 14 and 15 on the next pages provide data provided by DHS on application processing times. Exhibit 14 shows that statewide in fiscal 2023, the average number of days to process an application was about 36 days. Through November 1st in fiscal 2024, the average was about 29 days. There are about 5 individual local administering agencies that had average processing times of 40 days or greater. The analysis asked DHS to comment on some of the reasons for these longer application processing times, specifically for the large increase year over year that took place in the Southern Maryland Tri-County Action Committee, as well as provide some additional context for some of the larger decreases in processing times that took place in Allegheny, Prince George's, and Washington County. For Exhibit 15, the percent of applications processed beyond the 55-day guideline in fiscal 2023 statewide, about 22% of applications were processed beyond this time frame. In fiscal 2024 through November 1st, the percentage was about 14%. For this exhibit, the analysis is asking DHS to comment on the percentage of applications processed above 30% that occurred in Anne Arundel, Prince George's, Montgomery County, and the Southern Maryland Tri-County Action Committee. The final issue that's covered in the analysis is discussion of the establishment of a centralized administrative model for energy assistance. In prior years, DHS has indicated that there would be a transition occurring in future years for transitioning energy assistance administration to be done under LDSS models. Currently, administration of these programs is done under a combination of LDSS, local government offices, and nonprofit community action agencies. In its JCR submission response, DHS indicated that there were some additional maintenance and enhancements to the MD Think system platform that would need to be undergone before this transition could occur. DHS indicates that the current timeline would be for this transition to occur in around fiscal 2026. The analysis notes that this represents about a 2-year delay from the time frame that was indicated by DHS during last year's legislative session. I'd like to conclude with the DLS recommended actions, which are shown on pages 32 and 33. DLS recommends the adoption of 3 items of committee narrative. The first action would request a report from DHS on energy assistance application processing times and denial rates, similar to what has been provided by the department in recent fiscal years. The second item of narrative requests a report on the implementation of changes in eligibility for energy assistance under the implementation of categorical eligibility, as well as asking DHS for additional data on the number of households that were newly eligible under these changes. And the third recommendation is to request a report on the centralized administrative model that DHS plans to implement, as well as some of the timelines and costs associated with this model. I will conclude my presentation there, and I can take any questions at this time. Thank you.
Thank you, Mr. Quist. Seeing no questions at this time, it's appropriate to bring up the agency.
Good afternoon, Honorable Chair McCray and members of the subcommittee. My name is Carnitra White, and I have the pleasure of serving as the Principal Deputy Secretary for the Maryland Department of Human Services. Secretary Lopez sends his regrets and apologies for not being available today, so you just get me and the small crew that I have in the back. So hopefully we will be able to represent well for the department today. We want to start by thanking Governor Moore, Lieutenant Governor Miller, and our colleagues at the Department of Budget and Management and the budget committees for their support. We also would like to thank Mr. Quest for his budget analysis. Joining me at the table is my colleague, Acting Chief Financial Officer Kirill Resnick. And as I said, I have members of our team in the back to assist. We serve to empower every Marylander to reach their full potential by providing preventive and supportive services, economic assistance, and meaningful connections to workforce development and career opportunities. Today, we're here to speak with you about the Office of Home Energy Programs, which we call OHEP, and it is housed in our Office of Family Investment Administration. OHEP administers emergency assisted benefits through a network of local departments of social services, community action agencies, as well as local municipalities throughout the state. Each year, OHEP provides services to 100,000 plus Maryland households, many of whom are seniors, some so that they can pay their utilities that are needed to stay warm during the winter months, prepare meals, and power utility equipment such as oxygen tanks and other medical equipment. Today, I'm going to highlight two areas. First, customer service, and second, programmatic changes. Since we took office last January, this administration has moved with urgency to address what we found are long-standing and significant customer service issues with OHEP. Let me be clear. Marylanders who come to us seeking help for heating their homes deserve the world-class customer service. Weekly, sometimes daily, we receive, me personally, as well as the secretary, email from Marylanders who are challenged with accessing the critical, oftentimes life-sustaining services offered by our OHEP program. And this is just simply not okay. The process for applying for these services is too cumbersome. It takes too long to determine eligibility, and we have failed to leverage leveraged technology to access these services. Our local administrating agencies, which we call LAAs, are simply not processing OHEP applications fast enough to prevent utility shutoffs. And in some cases, it takes months before a customer will receive a decision on their application. Again, this is unacceptable. We're addressing the systematic customer service issues of this life-saving program. Over the past 9 months, we have set clear expectations with our LAA's partners for case processing timelines, for customer service, and we've issued a new standard operating procedure to better identify and prioritize emergency applications for households at risk of experiencing utility cutoff. We partnered with advocates to share brochures, flyers, and videos that help guide customers through the OHEP application process. In previous hearings, we've mentioned our partnership with Code for America, a nationwide leader in bringing human-centered design to government services. Together, we're making design improvements to MD Think customer website so Marylanders get the help they need. We're piloting our project with Code of America in the next month in both Baltimore and Queen Anne's counties. Using our pilot portal, customers will be able to apply for assistance as they work on My MD Think, but under a simpler, more streamlined online application. We hope to learn quickly by engaging with the people we serve more regularly. We will assess the effectiveness of this pilot based on the data such as the application start to completion time, which we know now people get stuck when they're trying to do an application and can't complete it, the accuracy of the data submitted, the application drop versus completion rate, and the mobile device accessibility, which we know now MD Think does not have that mobile device accessibility. We will refine the application throughout the pilot until we reach a point where we feel comfortable with the final product based on customer feedback. Our goal is to have a mobile-first application that a customer can start and complete within 20 minutes. This has never been done before at DHS, and we must push ourselves to try things to better respond to the people we serve. This year, our team will strengthen our customer service practices, accessibility, and language requirements in all future-facing LAA contracts. The Secretary and I have personally committed to visit the OHEP offices across the state to learn firsthand the challenges that Marylanders face applying for assistance. We will streamline how Maryland accesses the help they need when they need it most by modernizing MD Think so we have universal access to benefits across agencies. We want to make this simple for our customers. In all of this work, we will lead by taking accountability for continuous quality improvement. And we look forward to updating you on our progress next year. Next, we'd like to update you on a few programmatic changes we've made in response to recent legislation. On April 1st, 2023, the Maryland Public Service Commission ended the extended utility payments plan that were in place since the beginning of the COVID pandemic. This expiration of payment plans is driving a 24% year-over-year increase in our applications for energy assistance as households struggle to cover utility expenses accumulated during the pandemic. In 2023, we had over 149,000 applications, and this is the highest applications we've received since 2019. Effective October 1st, 2023, we adjusted the income threshold for the Maryland Energy Assistance Program to 60% of Maryland's state median income. With this change, more households qualify for energy assistance. So last year, many households earning $50,000 for a household of four did not qualify for energy assistance. With these adjusted income changes, these households now qualify for assistance. We've also successfully implemented House Bill 323, which was passed in the 2023 legislative session. And this required the department to automatically enroll SNAP and TCA households in energy assistance program. Just in the month of January alone, over 9,000 customers were automatically enrolled in the OHEP program. We will continue to monitor this and make the necessary adjustments so that we can improve the results that we serve. As you can see, I've highlighted some progress that we've made to streamlining access to OHEP, but we have much, much more to do. We will continue to act with urgency to improve our customer service and make applying for and receiving these critical services simple, seamless, and swift. As I mentioned earlier in the testimony, OHEP is a division of our Family Investment Administration. For next year, we respectfully request that OHEP be included in the Family Investment Administration's budget hearing. There's no need to separate OHEP from OHEP's budget from the very team with whom it should be working closely to seamlessly serve Marylanders who ask for help. All of our benefit programs are under the Family Investment Administration. And so we would like for these all to be done in one hearing. This budget proposal was assembled in partnership with many of you and others. And we stand ready to work with you to deliver bold investments in a fiscally responsible way to make this Maryland's decade. And now I'll turn it over to my colleague, Acting Chief Financial Officer Kirill Resnick, to summarize our responses to the analysts.
Thank you, Madam Principal Deputy Secretary, and thank you to the subcommittee. My name is Kirill Resnick. I am the Acting Chief Financial Officer for the Maryland Department of Human Services, and I will respond briefly to the analyst questions and recommendations. To question one, the question regarding asking us to comment on the reasons for the decrease in participation among households with members over the age of 60. In fact, the decrease is a percentage decrease, not an actual decrease. Because of the increase in applications that we have received as a result of the changes to the application qualifications highlighted both in the analysis and by the Deputy Secretary, the number of applicants have gone up, and as a result, it looks as if the number of households with people over the age of 60 has decreased only by percentage. In our response, you will see there is actually a chart for the number of applications and household size in that, making that comparison. To question two, asking us to comment on the total amount of funds that were budgeted and that exceeded the statutory annual collection amount. For that, we're going to apologize and say that there was a mistake in the department's budget submission, which there was. We have no intention of exceeding the statutory allocation of $37 million for the EUSP program. To question number three, asking us to comment on the reason for the increase in the average number of days for processing applications for the Southern Maryland Tri-County Action Committee, and correspondingly the decrease in for Allegheny, Prince George's, and Washington counties. The increase in processing time for the Southern Maryland Tri-County Community Action Group is as a result of a combination of staffing and resource concerns, as well as the increase in applications that they have received. Conversely, for Allegheny, Prince George's County, and Washington counties, we've seen the opposite result. We have been able to hire appropriately, specifically targeting the folks in the application to clear the application backlog. And so we've seen a decrease there. We are working as a department to model the responses that we have seen in Allegheny, Prince George's, and Washington County across the state to be able to make sure that we have appropriate resources and personnel to be able to process these applications. Overall, though, as you can see in the testimony, the FY24 application processing times have actually decreased statewide. So we're getting there, but we're certain locations and counties within the state need additional resources. To question number four, asking us to comment on the high percentage of applications that are processed beyond the 55 days in Anne Arundel County, Prince George's, Montgomery, and also the Southern Maryland Tri-County Community Action Committee. We acknowledge that 55 days is way too long. But again, the contributing factors are staff and application, the increase in applications, as well as there is a 90-day overturn period, which allows customers to provide missing information for 90 days past the application date. This overturn period has decreased application denials, but has increased our processing time. So we are working to again, correct those actions and make sure that we are reaching out to customers who are applying for these programs so that they can provide the appropriate information within their application initially, rather than having to return back and provide additional information. And to question five, asking us to comment on the suggested narrative provided by DLS. We concur with this recommendation and happy to provide the report. To DLS's recommendations for recommendation 1 and 3, which request budget narrative language, we concur with the recommendation and are happy to provide that report. To recommendation 2, that is requesting additional budget narrative. We also concur with that recommendation. However, we are respectfully asking that the due date be changed to February 1st, 2025 to account for capturing the full reporting period and be able to provide the full scope of information to the committees. So with that, I'd like to thank the committee for their time. We are obviously open to any questions, and we respectfully request that you pass the governor's allowance. Thank you.
Thank you. Senator Zucker, is that offline or?
I was just, sorry.
I'm messing with you.
Sorry, I was teasing my phone.
All right, we'll all tease them. Seeing no questions from the committee, just want to thank you, Mr. Quist, for your diligence and articulation of the respective agency report. And thank you all. And we're going to tell the secretary that you all did a phenomenal job.
I'm sure he's gonna watch.
He's watching.
And critique us himself.
Yeah.
Thank you. Thank you.
Colleagues, this ends the hearings for. Oh, we do have one witness. If we could bring up Cindy Carter from Cancer Support Foundation. We have one. If you want to come up, it's only 2 minutes. Come on, please.
I say that for informational only.
We only have, please come up.
Thanks.
Good afternoon. I'm Cindy Carter, Executive Director of Cancer Support Foundation and the co-founder of the Critical Medical Needs Program. I'm here this year, the same as I was last year, in support of the Director of OHEP and her fantastic team, which has been running the Critical Medical Needs Program. It's the only way I get anybody any help is through that program because they work so well. I'm also here in support for the secretary for their patients and the clients that I've been allowed to send to them. I have worked in this field 19 years, working with the most vulnerable population. I'm here to request the most basic of customer service requirements. Phones must be answered. I have seniors, I have vulnerable people stuck in their homes, have no technology, cannot go to offices, do not have computers, do not have helpers to work with them. They cannot get answers on the phone. They cannot get anybody to help them with an application over the phone. If they come to us, we try to get them into critical medical needs, but that does require that they have the ability to get documents to us, which they do not have the ability to. Several of these cases are dire cases that I've had to, out of frustration, send to the secretary, but they've come to us because nobody answers the phone. They finally get to 211 or their hospital or the health department or some other organization, and they're given my number. So we are here in support of what's been done and support with what we hear is going to continue to be done. But the basic service of a working phone where people answer and talk to people and call them back and help them over the phone is a necessity that just cannot keep being pushed aside and not being done. Thank you very much.
Good morning, Chairman McCray and senators of this committee. I'm Laurel Peltier. I am the chair of Maryland Energy Advocates Coalition, and our focus is low-income utility bills. I'm also an AARP utility advocate, and Cindy and I, we are here. We had to be here because we were here last year, and the team behind us has been awesome. We are the last two advocates, I think this is safe to say, in the state that care about OHEP and work on it day to day. And what I wanted to share is it's really, really been great. We're also on the state's low-income utility task force, which was put in by Delegate Davis and Senator Augustine in 2021. So we all have been working hand in hand for 2 years. There's some really cool stuff that we asked to be done, like sharing the videos we've made. I brought the one pager that our teams have collaborated with, and I wanted to share that it's been very positive. And just having Carnitra, or Secretary is your official, and Augustin, I mean, the fact that it really has been a great relationship is a big deal because it was a mess. These guys got a mess. What I'm asking for and what we are asking for is I can't share. I couldn't even say what Cindy said better. Customer service, it's so neat that we are being very honest is weak. And honestly, Senator McCray, in the Baltimore City area, it's terrible. And there's 5 local offices there and they're really struggling. I, by the way, spend 2 hours a week out in the field helping people at the GEDCO Community Service Hub get their energy service applications in. So here's what we ask, and we're going to send this in a nice email to the team. We would love for, we have 1 million more low-hanging ideas. We think there's some really simple things that are more mindset oriented that don't involve MD Think. And secondly, we thank you. The Low Income Working Task Force report isn't out. We asked for them to please release that. And lastly, BG&E terminated 80,000 accounts last year. Things aren't good. 50% more accounts were terminated last year. So OHEP is extremely important. 7% of the customer base got terminated. So we are here and thank you for supporting OHEP and putting them in FIA. Thanks.
Real quick. First, Ms. Carter and Ms. Peltier, just want to say thank you for your leadership. I don't remember the phone issue last year, or we would have did some form of narrative around it just to make sure. I think that I feel confident saying that I believe that the secretary would like to see folks responded to in a certain time frame and things of that nature. So what we'll do is we'll follow the issue during the interim to make sure, because I wholeheartedly agree with you. I hate when I call private companies and I can't get the phone answer or some type of automated, the way it's more frustrating because I wouldn't be calling if I didn't have a problem. But I really don't like it when I'm thinking about from a governmental standpoint. So I just want to say we hear you loud and clear. It's an issue that we would like to look into more and that we are going to look into more and discuss it with the agency. Okay, perfect. Senator Hatterman.
Thank you, Mr. Chairman. I just want to say thank you both for your advocacy. I know you work really hard, and Laurel, great to see you as my constituent.
I know.
Thank you.
She's my girl. Thanks.
So colleagues, this officially ends the hearings for HHS and look forward to seeing you all next week. Thank you.
Thank you for coming. We wanted to support you guys.
Oh, thank you. Good job bringing up issues and been working slowly for sure.
I'm listening. Go.
Yeah, that doesn't help the phone thing. At all. No, we have some of these, I think we can say this is.